And welcome to the Don Bullock Chevrolet Morning Show. For this segment, we have Nash UNC. We're always glad to have Nash UNC in the house. We have Sterling Grimes. We have had her smiling face on before. And we have Carrie Finch.
Good morning.
So glad to have both of you.
Thanks
Sorry,
for having us.
I interrupted you.
No.
Sorry. Glad to have you here. This morning we want to talk about the wonderful cancer center. You know, we've talked about that many times on the show because I'm just a fan. When I went and when they had the ribbon cutting and I went over and we filmed, I was so impressed.
Well,
I was
thank
just
you.
so
We are
impressed.
too.
Yes, I know. Especially when I found out, so you can have your treatments right here at home, and you know, that's kind of a devastating time in your life, and you know, traveling to Raleigh and Durham and all over, it's taxing.
Mm-hmm.
It's it can be very taxing.
So we opened the Danny Talbot Cancer Center in January of 2018. So we're approaching 18 months.
Wow.
I know. We built around what were the 2 radiation oncology linear accelerators. I know that's a mouthful. Those are very expensive, and of course it would be way too costly to move, so we moved infusion services and medical oncology right in front of them.
Right.
So now we have radiation oncology, medical oncology, infusion services, as well as all the support services, dietitian, social worker, clinical research in one location that's very convenient, easy to park, and easy to navigate once you get in the building. Because just what you said, I mean, when you have cancer and you feel yuck already anyway,
exactly.
It is no fun to have to drive any more than you is required.
That's
it's absolutely
right.
necessary. So what I tell people sometimes is medication is medication is medication. No matter where the medication is, it's the same thing.
That's exactly right.
So you just have to believe and trust in your medical professional who's prescribing and administering, which I do.
Right.
Believe and trust in the physicians that we have here and the team we have caring for them.
Well, we're very proud to have the facility on campus at the hospital. We really are. And Carrie,
Yes.
you do not live in Rocky Mount.
I
you
do
are
not.
one of the UNC staff.
I am.
Okay, and your focus is clinical trials.
Yes, so we partnered, I actually work with UNC Office of Research Support and Compliance, and we partnered with UNC Nash Cancer Care to help establish an infrastructure and build a research program here in Rocky Mount, because one of the initiatives from you think Chapel Hill, the university setting, is to kind of bring those same services out to the local community so that people don't have that burden of traveling. Sure. So that's, I started here at the beginning, physically coming out to Rocky Mount at the beginning of 2018. And we started our first trials at the end of last year. So patients have been able to kind of take part in some of those early questionnaire type studies and things like that, and we're beginning to expand on that, which is a good opportunity for everyone here to be part of clinical trials in Rocky Mount.
So you've heard of Lineberger.
Yes,
a lot of people
absolutely.
have heard of Lineberger. Trying to understand, what is Lineberger? Well, our goal was to be able to provide some things that Lineberger can provide in Chapel Hill here in Rocky Mount.
That's saying a lot.
Right.
It really is, because that is a state-of-the-art, fabulous facility. So, and that's what we have here now. So, we're so proud of that. So, Carrie, explain to the viewers, what are clinical trials?
So, clinical trials, like the definition, is just taking part of a research study that's studying people. There's a lot of steps that go into medications being available to you in a pharmacy. Many years of research process. So we are looking at different types of trials here that study medications, but also study like preventive medicine, screening or diagnostic trials, that sort of thing, or just quality of life questionnaires. There's kind of something for everybody if it's something that you would be interested in. Right now we actually have what we call a senior registry that's open for people that, as long as you're 65 or older, then we would like to collect information about your quality of life and your physical age compared to your functional age, and just looking at information like that.
So the advantages, why would I want to take part in this? And you kind of answered that, medications and that I would get and things like that. But what are some of the advantages to the person that would be taking advantage of this?
It's kind of a fine line because it is research, so you can't promise that you're going to get a benefit. But some of the benefits are that, especially in cancer trials, that most of those are compared to standard treatment. So you're going to get the standard treatment that would be available, but you may get the newer treatment. So that may be a potential benefit. Also, I think the other benefit is just knowing that what you're contributing is helping science in general and the medical community improve care for future generations. So, when you think back, like we all take a Tylenol or ibuprofen like it's nothing, but those actually had to be studied as well.
Right. Okay.
There are so many new oncology drugs, we'll call medications, coming on the market, whether it's a shot or a push or an IV or even a pill, and all of those had to be researched.
Right.
But what's also cool, and I've learned this more from Carrie, is not all research done at UNC or done anywhere, Duke, done anywhere, is always all medication.
Right.
So there is research when it comes to, which I've learned from Carrie, imaging. Should we do additional, an additional CT for staging? Should we gather additional data? Should we draw additional lab work?
Right.
So it's just, I think it's really neat to see how what a patient does in Rocky Mount may be the same thing a patient's doing in California, all part of the same trial working towards a greater good to figure out what will be better for generations to come.
Wow. That's very intriguing to me. It really is. So if I decide to do this, how would I join?
Well, I feel like the website is probably the best place to find most of the links and information. If you go to Cancer Care, there's a clinical trial tab, and you can find that information to reach me, to call me. I'll be happy to talk to you on the phone. Make sure that your criteria meets. Each study has its specific criteria that you have to fit into. But that's called a phone screening, so we would do that.
Right.
You can also, we have a lot of, kind of brought that here, a lot of resource information available in the Cancer Center. That's one of the nice things about the new Cancer Center, as well as it has a resource center for you with lots of information, and you could come pick up flyers, and if you physically need to see something in hand, there's a computer in the waiting room that patients can access and look up trials and information as well.
The 3 medication programs that or trials that Carrie's really working on right now were really at the request of Dr. Manicum, our new newest medical oncologist, and Dr. Austin Johnson. And based on the struggles and disparities and diagnosis that we see, they're really focusing on breast cancer, colon cancer, and lung
That's what I was
trials
fixing to ask
first.
you.
Yes.
Which cancers are you focusing on now? Okay.
Yeah, those 3, because viewers may not know this, but breast cancer is the #1 diagnosed cancer for women and in general, other than skin cancer.
Right.
So of the 600 newly diagnosed patients that we will likely diagnose at Nash this year, probably 150 will be breast.
Wow.
So that's why we really want to make sure that we're meeting our population where they are.
Right.
But like she said, there's a ton of trials that I've learned about that have nothing to do with the actual medication being given.
Right.
There's just other ways to gather research.
Just for another example is a prostate cancer study that we have in the works as well that hopefully will be coming in the next few months that just looks at, are you, working and then you were diagnosed with prostate cancer, and how does that affect your ability to work? And so it's some phone calls and things like that. So it's a relatively simple involvement, but it's helping gather information so that we can adjust care and help with treatment.
This is wonderful, wonderful. So if a person decides to take part in these, what exactly, because they might say, well, it's kind of scary, what do you do to me? How does,
so before anyone ever officially decides to do this, there's what we call the informed consent process. And it is a process. And that involves me sharing as much information that we can provide to give, if you were the patient, that comfort level for you to involve your family or those close to you to make sure that this is the best decision along with your healthcare provider. So if it's Dr. Manicum or Dr. Alston Johnson, that everyone feels that this is the best decision or an option for helping just supplement your care as another option for treatment with you.
So you would say that it's important, these clinical trials are very important for good outcomes.
To keep moving us forward.
Yes.
I mean, as a nation, as a world, as Rocky Mount.
Right.
I mean, to keep moving us forward into knowing what works and what side effects and how it impacts people. There's so much research in the world, but there's so much in oncology. I mean, there's so much big data in oncology too. So we have the ability to tap in that and use it.
That is wonderful.
And have it, and each community is different. The cancers that are seen here in Rocky Mount are a little different than those that are seen in other areas of the state. And like she was saying, that breast cancer is very prevalent here.
It is.
And having those trials, that's why it's important to bring the studies that are relative to this community here.
Well, we certainly thank Nash for doing this. It is such an important thing. If you do want to take part, or you are curious, or you do have questions, give us the website.
So it's the Nash Healthcare website, and your extension is, what's your phone number? You can call the main number.
Yeah, the main
252-962-4150. That's the main cancer center phone number. And you can ask for Carrie, or you can ask to speak to me. I'm Sterling. I'm the director of the program. But we really want to better answer questions, and a lot of the trial initiation is driven by patients, but also their physician. That they really want to try something else, or they've read something, or there's just something new that they really want to do for this particular patient. And not every patient needs a trial, of course, but for those that do, we want to be able to meet them where they are.
Right. Okay. Well, this is exciting. If you want a tour, for those that might want a tour of the Cancer Center,
definitely.
Can folks come out and get a tour?
Yes, we're very proud of it. I was telling somebody I did 3 tours last week, with different groups or different individuals who potentially are interested in having care locally to home, or one of them was a civic group.
Right.
So we love to show it off. We're very proud of it.
Yes, it's something to be proud of.
I know, we're very proud of it. Dr. Manicum is our newest medical oncologist. He joined us last October, and he said he's been in quite a few cancer centers, but never anywhere where the infusion center was set up quite like ours.
Really?
It's modeled. We toured about 6 or 7 before we built ours, and we thought or tried to take the best and the brightest from all the different locations where we toured. So it's much more structured, probably like UNC Chapel Hills Infusion Center, where the bays are actually semi-private,
Right,
which is
right.
nice for somebody like Carrie who needs to touch base with a patient,
That's
that's
right.
having treatment, or somebody like Delphine, who's been on the show, our social worker, and a patient's having treatment and she wants to go connect with them. So that was really the intention, is to be able to communicate as a group, but also have some privacy while, if you want to rest or need to have a conversation.
That's right. Okay. Well, thank you, girls, for being on. We
Thanks
thank
so
you
much
for
for
the
having
info.
us. Yes,
so
thank
much.
you. Thank you.
And please give them a call if you're interested, or go to the website. We'll be right back with more of the Don Bullitt Chevrolet Morning Show.
Thank you.